Hey guys, Ralph Havens here, Beyond Limits Physical Therapy in Bellingham in Fairhaven, Washington. I'm in the Chuckanut Mountains on some of the most beautiful trails on the planet. And as I was running, I had a thought about what makes integrated manual therapy different, what makes the way I do things differently than many practitioners. And I've been running into a pattern that quite frankly irks me. But it's, everybody's got their path, everybody's got their beliefs, and I should respect that. I really need to work on that. And but I hear some people talk about you don't want to give people, they call it expectation fallacy, like to dream big is somehow not good, is not useful. You don't want to get people's hopes up. And I've had therapists, a couple of them now, that don't even like to talk about the idea that we're going for a result. They don't even want to talk about a result being a goal. And they say stuff like, well, most of the time it gets worse before it gets better. And I've heard people say, it's going to be a slow process. Right off the bat, the very first session, it's going to be a slow process. And that irks me, because what it tells me in my work when something isn't working is that I'm in the wrong place. I'm looking at the wrong thing. I don't have the root cause. I have the wrong technique. There's something better. And, years ago, this is a race that I didn't get to run, the Neenacker in Vancouver, Canada, 2011. And I had severe bone pain and severe kidney problems and GI problems and liver problems and depression, and nothing was working. I mean, nothing. 2011. And what I found, thank God, was that it was fluoride. Fluoride was being put into the San Diego water for the first time, and I was using a Kangen machine that was supercharging it, and I was depositing fluoride in my bones and in my tissues. And then I found out through research that, oh my God, it causes all these conditions. Bone cancer in little boys, lowers IQs in children, causes depression, causes severe bone pain called skeletal fibrosis. And so we got filters, and I started feeling much better, but then I had to find something else because I still couldn't run. I had severe bone pain, couldn't run, 2 years. And then we found borax, literally the laundry aid borax. It's got a mineral. What borax is tetraboron. It's an essential mineral. And I, with a very specific dosing, put some tetraboron in my body and some magnesium, and within 3 days I was back to running. Now I could have listened to all these people, all these experts, all these people that just didn't know, that told me that I'm never going to be able to run again. Or I could keep looking. And years ago, I'm a physical therapist, and back in the mid 80s, I was doing standard orthopedic physical therapy. But there was a problem. People weren't really getting that much better. I mean, some of the people that were healing, but they were healing, I think, just because time went by. And then I found a therapist, Neil Sturman, my first mentor, and he was doing what's called craniosacral and visceral manipulation, mechanical link, through the Upledger Institute. And he was getting results with people with chronic pain, chronic injuries, chronic conditions. And I thought, I don't know what that is. It looks foreign to me, but it's working better than what I'm doing. So I studied that in depth, at great detail, went at the highest levels of training in that. And then I found Sharon G. Mateo, Integrative Manual Therapy. And she used to teach for Upledger. And she still had severe problems, and her kids had severe conditions. And she found a way to heal them up, to fix them up. And they got their health and their life back. And she developed a whole method called Integrative Manual Therapy. And that led me to 116 classes since February of 2000. I still take classes from Dr. Tom G. Mateo. Sharon has passed away 10 years ago. And then I found Matrix Energetics, Richard Bartlett, and I saw people changing even in an instant. And I thought, I got to see where this goes. And I came back around to all my other training after 2 years of testing in Matrix Energetics, because a lot of people healed very, very, very fast in single sessions. And so not everybody, and that's why I came back to everything else I learned. The thing is, there's always better. There's always faster. There's always beyond fast. There's always beyond limits if we keep looking. And so I'm challenging therapists out there, especially some therapists that recently I've run into two, that said it's going to take a long time. It's going to take a long time. It's not going to, you're not going to really see, I don't really want to talk about a result. We don't talk about results. We don't talk about results? Really? And so then I found Peace Process and found that it was the work of Yogananda and Eckhart Tolle and Michael A. Singer and David R. Hawkins. And it was a way to find and fix, clear out the mental, emotional, spiritual root causes of pain. Heart sadness is real. Deep grief in your lungs can cause all sorts of physical and health challenges. And so I saw how that can change things instantly and very, very fast. So, you know, one of my teachers, the great Kim Burnham, PhD, she's got a new book on Ehlers-Danlos syndrome. And she told me once there was a therapist that came to her and was complaining about a patient that was a 40-year-old patient, and he still wanted to play high-level baseball. And he had a little shoulder impingement problem, a pain in the shoulder. And the therapist told Kim that, I kept trying to tell him, hey, you're 40 years old, you got to change sports. This isn't, this is a young man's sport. And Kim stopped in her tracks and said, you have to go home and work on yourself and see if you can come back and help your patient get their goals. And it sounds strong. You can tell I'm a bit irritated, but I just want people to get better. And I want myself to keep improving. And I'm here to say, if you haven't found your answer, if you're going to therapists, if stuff isn't working, when doctors have no answers, it's okay. People have their toolbox. They're trying their best, I know. But there's got to be a better way. One last example, my little boy had a problem with reading. And we were in a private school, Montessori school, and I'm paying good money for that. And the reading specialist was very, very good, couldn't figure it out. Very specific reading problem. And so we went to the public schools and met with all the psychologists and reading experts, and they tested my son and described his problem exactly. He said, here's what he's got. And we're like, yeah, this is the problem. And I said, okay, here's what we're going to do. We're going to bring him into the public schools for 4 hours a day. Well, we pay for private school. Go 4 hours a day, and he's going to go to these classes, and he's going to work on this thing. And I said, okay, great. How long is it going to take to fix him up, to make this good? And they said, oh, no, he's going to have this for the rest of his life. He'll have this in college. And I was walking back to the truck, and I told Jen, somebody has fixed this. Somebody's fixed this. And she found somebody. And he was an engineer who described the exact same problem that my son was having. And he had it, and yet he still became an engineer. But then his two sons had the exact same problem. He described it exactly. And he made a video game module program, a course, to fix it up. And so we did the free version, and it was a bit better. And my son liked it. And so then we bought the course, and we did it every day. And he started to read better and better. And within a couple months, I don't think it was more than 3 or 4 months, it might have been 6 months, but every week was better. And he solved it, and he's great. And his teacher in public school, now that he's older, says he's an amazing reader. He writes volumes and volumes. He loves reading. So, if we would have listened to the experts, there was nothing that could be done, really. But you were going to go still spend all this time and effort and just, be okay with this is going to be there even later in life. So this is a message. I hope it's you're getting some hope out of this, because, I got to have one more example, because this is really a thing. If us as therapists and doctors, I'm not a doctor, if us as therapists keep looking and go beyond limits, beyond fast, and help our clients get what they want, that's what it's all about. And if we're not doing it, we can be better. We can be better. A bone, my same son fractured his tibia, his lower leg, in a swing accident right before his track season was about to start, or before his training was about to start. And he was devastated. There's a way to test it and see, is it an actual fracture with a tuning fork, and you touch a tuning fork that's vibrating to it, and if it hurts really, really bad, it's a fracture. And he knew that, and we tested it, and it hurt really, really bad. And we both cried, because I thought, man, a whole season is going to be way put on hold. And but I have a technique called bone bruise technique that Sharon Giammatteo, the late Sharon Giammatteo, found. And she initially called it bone fracture technique. But her colleague, Frank Lowen, said, you can't say that. It's heresy. You know, the medical system won't like you to say that. And she goes, well, fine, we'll call it bone bruise technique. And so I did the bone bruise technique. And within a week, he was significantly better. Within a couple weeks, he was starting to be able to jog. And it wasn't much soon after that, he was totally back. Now, normally, a bone stress reaction fracture type thing, we're talking in a boot, we're talking 6 weeks, 8 weeks. We're talking a bone like that that has a lower blood supply, might be a lot longer. But my teacher wasn't satisfied with that. There's better, there's faster, there's beyond limits. So if you want to find a way out of your pain, if your problem, reach out to me. If I don't know how to do it, hopefully I know somebody else that knows how to do it. Because there is a cause, and we do go for results. We go for results. So for what does your heart desire? Let's go and get it.